Hey everybody, I'm Lainey with Medicaid Saves Lives, and I have Marquita and Kevin here from Arkansas Advocates with Children and Families and Legal Aid of Arkansas. And today we're going to talk about Arkansas Works, also known as the private option. And as you may have heard, there's going to be some changes that happen. So I have these two experts here with us today who are going to give us all the information we need to know to help you respond well. So let's get started.
Okay, great. So as Lainey said, I'm Marquita. I'm with Arkansas Advocates for Children and Families. And so I'll get us started. So first, we want to just start by talking about and providing a general overview of the Arkansas Works program. Just want to make sure everybody knows what the program is, which will hopefully help you decipher if you might actually be impacted by some of the changes that we're anticipating to the Arkansas Works program. So the Arkansas Works program, as Lainey mentioned, which also is known as the private option, it's an affordable health insurance program that the state implemented in 2014, and it's for adults that earn have a low income. It was put in place as a result of the Affordable Care Act, or Obamacare, and it's a little bit different than other states that may have a similar affordable coverage program for low-income adults, because in Arkansas what we do is we use the federal Medicaid dollars that we get to actually help people enroll in and pay the cost of a private insurance plan. And so that's why it's really important that we kind of provide the overview and background, because a lot of people might not actually realize that you are enrolled in Arkansas Works, because the card that you may have received in the mail and that you're using for your doctor's appointments could be a Blue Cross Blue Shield plan. So that's a really important distinction. More than likely, if you have one of those private insurance plans and you are not paying a premium, or you're paying a really low premium, you are probably enrolled in the program. One of the other labels or names that you might see on any document that you've received from the Department of Human Services, it might also refer to it by the formal name, which is also known as the Healthcare Independence Program. So again, I know that's kind of a lot of information to kind of decipher through, but we wanted to talk about that piece just so you know if you might actually be impacted by the changes to the program, or if your family members, any of your friends might be impacted by the changes to the program. Since the program initially started, there have actually been a number of changes that have occurred. So the things that we're going to talk about today are basically the latest in a series of different requirements and changes that we've seen to the program. And one of the things that we've learned from that history of the changes that have happened in the program is that a lot of people aren't aware of how those changes will impact them until they actually go to visit the doctor, or until they show up to get a prescription filled. So we really just want to make sure that you know what those things are, and that you know what to expect, and that you have the resources, tools, and information that you need to be prepared before those changes come into place. So I'm just going to talk a little bit about what some of those changes are that we are anticipating and how it came about. So in 2017, earlier this year, state lawmakers met at the state capitol and had a couple of days dedicated to discussing and voting on implementing these particular changes. So that's an important thing to note as well, because at this point, they've already approved these changes going into place, but we are still waiting for a federal approval. So state lawmakers voted and said, yes, we want to make these changes to the program, but then the state of Arkansas has to request permission from the federal government Medicaid program to say we want to make some changes to this program. And so that piece is still what we're waiting on approval from, but by all accounts, we do anticipate that those proposed changes will be approved, and that many of the policies that will go into place, you'll actually see those happen at the beginning of 2018, so January 2018 for most of them. So what are the actual changes? So there are several changes, but I think there's two that really stand out that we want to address in a bit more detail today that'll probably affect kind of the day-to-day use of your coverage when they're rolled out. So one of those changes is the addition of a work requirement. So historically, this program, Arkansas Works, is treated as any other Medicaid program whereby it's never been a condition of eligibility that you demonstrate proof for participation in a work program. And that's really important. One of the reasons that's important is because a lot of people actually rely on having access to health coverage to be healthy enough to work every day. So the change that this program would put in place is that you have to demonstrate that you are working or participating in a job search, job-related activity in order to continue to maintain enrollment in the program. Kevin's going to talk a lot more in detail on the specifics of who will have to meet that requirement and what people will be exempt and how you actually comply. But I wanted to quickly provide that overview that will be a new requirement of the program. And for people who do not meet the requirement of that program for 3 months, you may potentially lose access to your coverage. And again, we'll talk about that in a little more detail. And I'll just pause too to remind everybody, if you have a question during the program, please type those questions and we'll be sure to answer those as those questions come into place. So one of the other big changes that we are anticipating to the program, it's actually going to be a change in the income eligibility for the program. And so there's some pretty clear guidelines today as it relates to your income and who's actually eligible. And I'll break it down into numbers, but it's going to change from 138% of the federal poverty level to 100. So the immediate impact of that, based on current enrollment, is that about 60,000 people, and this is what DHS estimates, about 60,000 people will no longer be eligible for coverage in this program, and will have to seek other methods of getting coverage. So I'm gonna get a little help here to actually illustrate to you what that change will look like. And it might be a little hard for you to see. If you can't, we can definitely take a quick screenshot and we can post it in the comments later so you can reference that. But if we can go back to that chart quickly, I'm going to talk through the differences that you'll see. So there's 2 lines here on this chart. The first line, the blue line here, shows what the current eligibility levels look like for the Arkansas Works program. That's 138% of the federal poverty level. So basically, they base this on where your income lands in relation to what's determined to be the federal poverty level. One of the things that you'll notice, if we could pull that back up quickly for me, and I'll talk through it. So one of the things you'll notice there is the blue line. If you're an individual, family of 1, and you earn today no more than about $16,600, you are eligible for the program. When the changes go into effect and we change the income guidelines, now in the future you won't be able to earn any more than about $12,000. And again, we'll post this so you can see the differences at each of the income levels, but we wanted to quickly show you how the income levels are going to change from what they are today versus in the future when these new changes roll out. Thank you. So here's what you need to know. On that chart, you probably saw that your household income is one of the factors that impact what the income threshold is for your eligibility in the program. Another factor is what that income is actually based on, and that is going to be, for most people, it's going to be based on your tax filing and things like if you had a dependent when you filed your income taxes. Generally speaking, those are going to be the key factors that impact what income level applies to you and what determines your household size. But there certainly are some particular scenarios where there might be some differences. But for the most part, those are the figures you need in order to determine if your eligibility for the program will change based on these new income guidelines. And again, I'll just remind everyone, that we are anticipating that at least 60,000 people will be impacted by the change in the income level, and will have to seek other methods for identifying health insurance. And so I'll just remind you once more that you can post your questions below, and we will try to address those. And I think we're also working on maybe getting a picture of the actual guidelines posted in the comments there for you to refer to. And we'll just make sure that we do follow up on all these things that we're talking about, so you can get the actual information that you need. So one of the other things that I want to bring up is a common question that often comes up, which is, well, what's wrong with the changes to the program? Besides sort of some of the obvious things that a lot of people won't be eligible anymore, there are also some issues that come up in terms of how these sorts of changes might be implemented. And so I just want to touch on a couple of those things to make you aware of why we do have some concerns about how these changes will be implemented and the direct impact they could have on the people who are enrolled. So the first thing that I want to talk about is the work requirements. So one of the issues with the work requirements that we are greatly concerned about, I mentioned kind of most people needing coverage to actually be healthy enough to work. We also know in many cases that there is typically at least one adult working in each of those households, and so some say that that work requirement is actually unnecessary. But another issue is that these types of work requirements often, based on research and previous experience that we have in other programs that have implemented these kind of work requirements, the one that stands out is the TANF program, which implemented similar requirements in '96. So we have a lot of actually long years of research and data that have been collected because those went into effect in 1996. They show that these types of work requirements are really not always effective and can even be counterproductive in terms of helping people to get into employment that allows them to no longer even have to rely on programs like Arkansas Works. So for example, what we know from research is that although people always, in many cases, they actually seek jobs with the assistance that the state might provide in helping them find a job, get work training, get placement, most of those jobs are often low paying, and they don't actually end up lifting those families out of poverty long term. And so in many ways, many families get trapped in these low wage jobs long term. The other issue with this particular policy is that there are a number of other factors, as many of you know, that can lead to difficulties with a person sustaining long-term employment. Sometimes it's just what part of the state you live in. Is there a strong job market? Actually having access to the health care you need to work, or other things like actually having access to high-quality, affordable child care in your community. And so, again, those are important considerations, and Kevin will talk about a little bit more what some of the exemptions are related to work requirements. The final thing that we want to point out related to the change in the income level is that there are often lots of challenges with people transitioning successfully from one type of coverage to another type of coverage. And so that's why the information we're providing you today is so important, because we want to do as much as we can to reduce that challenge. A really good example is in Rhode Island, actually. They changed their income eligibility in a way that's very similar to the changes that we'll see in Arkansas. They made those changes and they tried to help people transition successfully to another type of coverage. But one of the results we saw was that only about 30% of the individuals who were no longer eligible for Medicaid were able to successfully transition to another health plan and pay a premium to actually start their coverage. That's a lot of people who potentially might lose coverage if they aren't able to successfully transition to another program Another issue is understanding what costs might be associated with that new type of coverage that you may not have today. So understanding things like deductibles, understanding things like co-pays related to doctor's visits, or for getting your prescription drugs. Those are lots of the types of differences that people will see as they attempt to transition to these new plans. So one of the resources that are going to be really important in helping you determine if you are eligible based on these new changes to income is our state navigator program. Please. So we're going to hold that up as well, and we will also try and get that information posted for you later. But if you need help determining if you're still eligible or enrolling in a new program after these changes go into effect in January, you can contact Enroll the Ridge, and they provide assistance determining your eligibility and enrolling in the best type of coverage for you. And that's not just limited to Medicaid or to Arkansas Works. So again, just really quickly, these changes are going to go into place very soon once approved. They've already been approved by lawmakers at the state level, and we are expecting any day now the federal government to okay the state moving forward with these changes, and most of it will be implemented. We'll see those changes go into effect next year, January 2018. So I'm going to transition to Kevin now to talk a little bit more about these proposed changes.
Well, hello everybody, I'm Kevin DeLevon. I'm with Legal Aid of Arkansas. And for those who don't know, of course, we provide free legal assistance to people without very much money on a variety of civil legal matters in the state, including Medicaid-related issues and health insurance-related stuff. So Marquita mentioned the two kinds of changes. I'm going to really focus on work requirements, kind of what they're going to require of people who are enrolled in the program and how to comply. Before we go there, I just want to reiterate the income change, which is that if you presently earn above 100% of the federal income level and you are on Arkansas Works, starting January 1st, you will no longer be eligible, right? And then you will have to go to the marketplace to receive coverage, right? And that'll be subsidized, and that's where Enroll the Ridge can help you. So where we're focusing on for at least my presentation is the people who are at or below 100% of the federal poverty line come January of 2018. Those are going to be the folks who are still eligible through income to be in Arkansas Works, and then you'll have to meet these additional requirements that, as Marquita mentioned, nobody in the history of the Medicaid program has ever had to meet before. Arkansas may be the first. Now, the work requirements, some folks may be familiar with work requirements through the SNAP program, through the food stamp program. These are different, okay, and they work in a little bit of a different way. So the general idea is there in SNAP, but really these are Medicaid specific. And again, there's nowhere in the federal Medicaid law that provides that states can impose work requirements. It's just if the federal government will kind of approve it through this special request process that the state of Arkansas has done. So the first question, the way the state is proposing to implement the work requirements is all right now the subject of a promulgated rule. So it's proposed policy changes. The public comment period on these closes on Friday, October 13th. I'm holding up the proposed rules here. You don't need to see my handwriting or anything, but just know that they're out there, and you can find them on the DHS website where they post proposed rules. It's also available on the Secretary of State's website. They are open for public comment until Friday, and Legal Aid of Arkansas intends to submit public comments. So I've been pouring through all these over the weekend, and there's going to be a lot of real challenges for our client communities, for the folks who are watching this. The number one thing is that DHS is going to ask that everybody comply with the work requirements electronically. So what they're saying that you have to do, we don't think this is necessarily legal, but right now we're just focused on what DHS is proposing, is that you have to have an email address and that you'll have to get a login to one of their online portals. And it'll be through this online portal and with your email address where you will prove to DHS that you are meeting the work requirements. Okay? Now, of course, we know that a lot of folks don't have internet in their home. We also know that a lot of folks in particularly rural areas don't have good cell service. We don't know anything about DHS's proposed portal. We don't know if it's going to be friendly so that it shows up on your cell phone and is something you can navigate. We don't know if it's going to take 1 million hours to load. We don't know if you're going to have to upload documents or whether you'll just push a checkbox that says I comply. So there's all sorts of things that are really not known about this electronic system. DHS is saying that they will not accept paper verification. So most folks are used to being able to go to your local DHS office and hand them a paper application, or if you have to prove income, to show them your income paperwork or other things. DHS is saying that that is not going to be permissible, that it'll have to be electronic only, and they're not clear whether their local offices will provide that electronic access. So that's the first thing to know. You're going to need to have email, and you're going to need to be able to access this portal, even though we don't know what that means. Now, as Marquita mentioned, there are some people that are exempt from the work requirement, okay? Now, the work requirement is going to be applied to people who are between the ages of 19 and 50 years old. If you're 51, you don't have to worry about the work requirement. If you are 19 to 50, you do. Now, what DHS has said is that this next year, 2018, they're only going to make people who are between 30 and 50 comply with the work requirement. And then next year in 2019, they'll extend it down to the age of 19, all the way up through 50. So anyway, if you're between 19 and 50, you'll be affected. If you are 30 to 50, you'll be affected this year, certainly. Now, there are a set number of exemptions where the state has decided, for whatever reason, that these people who meet these exemptions should not have to work. And I'm going to go over those, and you'll forgive me for just reading from the list. I don't want to mistake it. And each of these has a different period for how long it's valid, right? So you might be exempted for a short while, or you could be exempted for a long time. The first one is if you are receiving an exemption through the SNAP program. The state will just validate that data on its own every 30 days. And if you're receiving T, which is Arkansas's version of TANF, or sometimes called welfare, the Temporary Assistance for Needy Families program, the state will just know that you're enrolled and they'll check it. Most folks are not going to meet those exemptions, okay? Most folks will have to fall into one of the others. If you are caring for an incapacitated person, you will be exempt. You have to prove that you're caring for an incapacitated person every 2 months. So let's say you prove it on January 1st, you'll have to go back and prove it again on March 1st, and then go back and prove it again on May 1st, and so on and so forth. So during the course of the year, you'll have to prove it at least 6 different times to show that you're not subject to the work requirements. Now, DHS has not told us what caring for an incapacitated person means, so we don't know. Is that caring for somebody who is elderly and has advanced dementia and can't make decisions on their own? Is that caring for somebody who just has profound physical disabilities, who needs a lot of assistance to do their daily activities? We don't know, but it is caring for an incapacitated person. The next exemption is if you have what they call a short-term incapacitation. Again, we didn't write these. If we would have wrote these, they would have been much more understandable. Who knows what a short-term incapacitation is? But if you have one, you go to DHS and you tell them every 2 months that you have one, and they'll exempt you from the work requirement. If you are participating in an alcohol or drug treatment program, again, you will be exempted from the work requirement. You have to prove it every 2 months. And remember, when I say prove every 2 months, I mean we're going online to this unknown online portal and doing something. Whether that's just marking a checkbox saying I am in a drug and alcohol treatment program, or I am caring for a person with an incapacity, we don't know. We don't know if DHS is going to make you, take a picture of a piece of paper and upload it to their system. We don't know. The next one is you're receiving unemployment benefits. If you're receiving unemployment benefits, you do not have to prove that you are working. That'll be good for 6 months, so you only have to do that twice a year. If you're in a full-time education, job training, or vocational training program, then you do not have to comply with the work requirements. You have to prove that every 6 months. If you are pregnant, you don't have to worry about the work requirements until the end of the postpartum period. which isn't defined in law. If you are living in the home with a dependent minor, you do not have to fulfill the work requirements. You do have to prove to DHS, of course, that you are living in the home with a dependent minor. Some folks know that there's this thing called medically frail. Folks who might be watching know that they might have applied for Medicaid expansion some years ago, and then somebody told them, okay, well, instead of Blue Cross Blue Shield or Qual Choice, you're going to be medically frail. I won't go into all what that means, but if you are medically frail, you will not have to comply with work requirements. You just will have to provide proof that you are medically frail. And the last thing is, if you're an American Indian or an Alaska Native, then you don't have to comply with the work requirements, but you have to prove that you are that. So those are those exemptions. If you fall into one of those categories, you do not have to comply with the work requirements, but remember, you do have to prove to DHS that you fall within one of those categories, okay? So don't think, oh wait, I have a minor kid at home, I don't have to worry about this. Nope, you do have to worry about this, because you have to show and tell DHS that you have that minor child at home that you're caring for, okay? So those are the people who are exempt. You have to prove it. Now, what if you're not exempt? What if you're actually subject to the work requirements? What does that mean? Well, again, for all of these, you have to prove it. And you have to prove it every month. And proof means signing on to the unknown DHS portal and doing something unknown to show DHS that you're meeting the requirements. The requirements are basically equal to 80 hours per month of work. Now, you can meet that through straight employment. That means through your job, wherever you're at. 80 hours per month. And you would have to prove that to DHS. If you're earning that at the time that you are applying for Medicaid, then they'll just take your application. But for most folks who are on Arkansas Works, you're already on it, right? You're not going to be filling out a new application. So when your renewal comes up, you'll have to prove that you are earning an amount of money that shows that you're basically working 80 hours a week. All right, I'm sorry, 80 hours per month. An 80-hour work week is only what Marquita and I do, and a bunch of other working folks do from time to time, 80 hours a month. There are various other ways you can meet it. Now, it doesn't have to be any one of these things, okay? It could be any or all of these in some combination that leads to 80 hours. You're employed. You are in less than full-time education or job training or vocational training. You're volunteering. We, again, don't know what volunteering means. We don't know whether participating in your church activity counts as volunteering. We don't know if it's a neighborhood cleanup. We don't know if you have to volunteer for a, sort of an official nonprofit or a food bank, something like that, that will count. But volunteering. If you do independent job search or job search training on your own, that can count up for half of the hours per month. And there's also something called a health education class that can count for a small number of hours per year. So those are the only activities that really count. Again, you're employed, you're doing part-time job training, vocational training, or education, you're volunteering, you're doing your own job searching. And you have to prove this to DHS every month, okay? And here's where it's really tight, is you have to prove it by the 5th of the month following the month of eligibility. So let's just say these changes take effect in January. That means by February 5th, you have to prove that in January you worked those 80 hours for the month, or that you had these other combination of activities for 80 hours a month. If you don't meet their deadline of the 5th of February, it counts as you not having worked that month, okay? You can only get 3 months of non-compliance in any given calendar year. Once you hit that 3rd month of non-compliance, you are terminated from Medicaid eligibility for the rest of the year. So we know, in particular in some rural counties, I spend a lot of time in the Delta, for example, and there aren't a whole lot of good jobs in the Delta. In Monroe County, for example, or Lee County. Let's say it's January 2018, you're not working full-time. 80 hours, or you're not working the 80 hours a month. February, you're not working 80 hours a month. March, you're not working 80 hours a month. That means you will have coverage for January, February, March. Starting April, you will no longer be eligible for Medicaid coverage. And you won't be eligible for Medicaid coverage through the end of 2018, okay? The only exception to that is if you become disabled, or you meet one of the other ways to get Medicaid that existed long before Obamacare, in that case, maybe you can get Medicaid. But otherwise, you won't be able to get Medicaid for the rest of the year. So that's January, February, March. You're done in April of 2018. You won't be able to get it again until January of 2019, at which point you would have to re-enroll. Now, DHS is saying that, let's say you got disenrolled in April, okay, January, February, March, you're not working. They say, okay, April, you're cut off. Well, let's say come July, your son or daughter comes to start living with you. And if you remember, living with a minor child is one of those exemptions from the work requirement. So you're thinking, okay, it's July, the work requirement isn't on me anymore, maybe I can get Medicaid again. Nope. DHS says no. Once you're disqualified for a calendar year, you are disqualified for that calendar year, essentially with no exemptions, or no exceptions rather, I should say. So this is a very harsh policy. Now, again, there's no clarity on how you're gonna have to prove that you're working. So what I'd recommend to folks is keep track of it. Keep track of your hours, keep your pay stubs. If you do some sort of volunteer activity at your church, maybe get your pastor to sign a note saying you were here for 10 hours doing such and such a thing. But documentation is going to be your best bet against getting disenrolled. The other thing is you might see if there's a family member, if you're not comfortable online or with the internet, you might see if there's a family member who might be able to help you every month. If you schedule your compliance, like when you have to pay rent or pay your mortgage, just remember, treat this as almost like a bill that has to be paid, where you just think, oh, before the 5th of the month, I better verify my Medicaid eligibility, right? To do those kinds of things. Now, if you're terminated, there are due process rights. And this is a term lawyers always like to use, due process, due process. What does that mean? It means basically fairness, essential fairness. DHS has to provide you a chance to say, no, cutting me off is wrong under the law, okay? All of us might have individual beliefs about whether it's wrong sort of morally or societally or anything else. That's not what the question is. The question is just, is DHS wrong under the law in cutting me off? Did they get it wrong? Did I actually prove that I met those work requirements in one of those 3 months? Was I actually exempt for some of those months? Did I show that? So that's what due process means. You're entitled to a fair hearing, and you can appeal. And whenever you get a notice from DHS, save it. If there's an appeal deadline, which is usually 30 days from the date you get it, file your appeal. If you appeal within 10 days from the date that you get it, you can continue your insurance until you have a final decision on your appeal. And this is really important. So let's go back to that example where I didn't work January, February, or March of 2018. They cut me off in April. Well, once I get that letter that says they're cutting me off, I file my appeal immediately, within 10 days, and then they have to keep my coverage on until I have a fair hearing and the appeal decision is made. Now, if I lose that, they can try to come back to me for any, and try to make me pay for any treatment I got while that appeal was pending. But at least it means some continuity of care while you're waiting for that decision. The other thing, of course, is to call Legal Aid of Arkansas. Now, there's a couple things here we want to do. Is we don't want people to just have to wait until they're cut off to call us, okay? So if you are watching this right now and you think you're gonna be one of the people who are affected, either because you are earning 125% of the federal poverty line and you know you're stably employed and you know they're gonna cut you off come January, you can call us now. Dial 1-800-967-9224. We have a special extension for folks who are having these issues. You dial 4, you leave a voice message for us, we'll get back to you within 2 business days. Okay, so if you're above 100% and you go, wow, I'm going to get cut off in a few months, call us now. Don't wait for then. We might not be able to do anything, but we'd like to know what's happening with folks. The other thing is if you're below 100% of the federal poverty line and you're not working and you're not sure if you're going to meet one of the exemptions or you don't think you will, call us right now, leave us a message. We'll get back in touch with you. We'll talk through your issue. We'll see whether or not you'll be affected. And that way you might be able to at least have some peace of mind or plan for what's happening. So we really want people to call us now right away, even though we might not be able to be super active right away. We can let you know what your rights are and we can know what's going on with your situation. And then of course, come January, February, March, April, May, June, once the changes actually take effect, if you get cut off or you think you're going to get cut off, you call us right away and we'll do our best to help folks there. So I think that's most of what I had to say. Do we have questions or is there anything?
And I think one thing too that I just wanted to follow up and mention, Kevin talked about the public comments. And so a lot of people might be thinking, wow, I'm hearing this for the very first time, or I didn't know that this was coming about. And so I do want to make sure folks understand and know that actually there's been a pretty long process prior to the state lawmakers voting on it. And then we actually had two comment periods that occurred. And so the state opened this up for comments and people weighing in, as well as at the federal level, they require those comments. So the reason I wanted to point that out is so that people know actually all of the standards and proposed policies that Kevin just read through, those are actually the result of people already weighing in. And those are the result of a lot of us saying, well, we're really concerned about this policy change. That's a result of hearing from a lot of you about how these potential changes will impact your access to coverage. And so I think that's important to note that we, our organization, Legal Aid, and a number of other organizations and advocates and individuals who will be impacted have been giving feedback, and we have already said, hey, this is not working well. Here's a better way to do this. And so the state has rolled out this proposal on how they'll make these changes, even after already receiving some feedback. And so again, I just think that's important to know that there has already been some feedback and a lot of us making suggestions on how we can make this less harmful, or why some of these policies are just not a good idea because it'll do more harm than it will in helping people.
And in all of those opportunities for public comment, DHS never said that they're going to do this electronic only verification system. They didn't say that people will have to have an email, that people will have to log on to a portal. They didn't say that people will have to verify by the 5th of the month. And for folks who have been on Medicaid, frankly, many of you will have experienced the long backlog where you might have been waiting for 3, 6, 9 months to access Medicaid. Some of y'all might have had issues with particular workers or offices where they didn't take your information on time, all these things. So you know that the administration of this side of stuff, the paperwork side of it, can get out of hand. So the public comment is open. I neither encourage nor discourage anybody from participating. Everybody does have the right to communicate with their elected officials and their government, though. Folks do have that right.
So I think we're going to take a few questions.
So we have one from Andrew who has asked, how does this affect people on our Path or Arkansas Choices program?
This will not affect people on AR Choices at all.
Okay, so it's a separate issue.
Completely.
Andrew also asked, how might this affect caregivers or in any government capacity working with the medically fragile? So they're really concerned about medically fragile people.
So the work requirements, so if somebody is a caregiver for somebody else, and that's their only job, and they are also on Medicaid through Arkansas Works, they'll be subject probably to the work requirements. So you'll either have to prove that you're exempt from the work requirements, or you'll have to prove that you're working at least 80 hours a month in a paid capacity. So the caregivers very much need to be aware of this, especially if they're getting their Medicaid through the Arkansas Works program.
Okay. Can we go back over the chart, which I
Sure.
tried to hand back to you? So we're going to post that chart, but according to that, can we just go over, as a single person, what would you have to make?
Sure.
I figure you need to know that.
Yeah, sorry. Okay, so we're gonna hold that up
Okay.
one more time here, just to walk through the chart, because I went through it pretty quickly, so good question. So first, as I mentioned, a lot of this is based on your income tax filings. But basically, it's determined if you're eligible based on your income as well as the size of your household. So if you are an individual today, you are eligible for the program if you fall into that 138% of the federal poverty level category. For one person, that's about $16,600. When this new requirement goes into place, that other column there where it says 100%, and so essentially that means no one earning over that federal poverty level will be eligible for the program in the future. So individuals at about, that limit's going to be about $12,000. And so you can see the difference, and we've tried to highlight it there. The blue arrow, current eligibility, the red arrow is what the new income level will be for the program. And so you can just kind of go down that chart, look at the size of your household, and make that comparison now to say, okay, so I certainly currently fall below this income level. When this change rolls out in January, it will shift to the other lower income there with the red arrow. So I hope that helps to clarify that a little bit. As we mentioned a couple of times, if you know based on those income guidelines that you will more than likely be impacted by those changes, you can contact Enroll the Ridge. That is the Navigator program in the state, and they exist solely for purposes of helping people enroll in coverage and navigate the challenge of enrolling in health coverage. And so if you're part of that 60,000 people that we know will probably no longer be eligible for Arkansas Works, then you should absolutely contact Enroll the Ridge, and they will walk you through identifying a plan on the health insurance marketplace, and possibly being able to get some assistance. Even if you're paying your own premium, you still may qualify for some help to actually reduce the cost. So I encourage you to call them.
Someone asked a follow-up to the caregiver question. So this, what your answer means, but only if they're on Arkansas Works insurance, correct?
Right. So if you're on Arkansas Works insurance, that's the only way these income limits apply, or that the work requirements will apply. If you have some other version of Medicaid, or you have some other form of health insurance, these won't apply to you.
Only Arkansas Works.
Okay. That's pretty much all the questions right now. So I think we've also gone over really well the chart, and your option is to Enroll the Ridge. Marquita, I'm really a little bit worried that at the beginning I didn't have the sound doing well. So
Okay.
Can you go over the summary of proposed changes again, just really quick?
Sure. So again, there's a couple of changes that are going to be made, but the ones that we really think are going to have the most impact on your access to coverage and care are the work requirement and the change in eligibility. So really quickly, and Kevin talks in a lot of detail about that, but today in the Medicaid program, regardless of which category you're in, including Arkansas Works, there is no requirement to demonstrate that you are working or participating in any type of work requirement. That is just how the Medicaid program exists in every single state, that your access to care should not be a condition of employment. And one of the reasons I offered is because, quite frankly, in many cases, individuals actually need that access to care and to be healthy enough, to actually maintain and work a job. And so that work requirement is one of the proposed changes, where you have to demonstrate that you are meeting the hourly requirement of actually working, or you have to participate in some type of job training or related requirement to maintain your coverage. The other significant change is going to be the change in income eligibility for the program. And so that was the chart that we just held up. The income limit is essentially going to reduce for individuals. And so we know that at least 60,000 people, based on estimates from the state, will no longer meet the income level for Arkansas Works, and you'll have to seek another source for coverage, most likely shopping for a coverage plan on the health insurance marketplace. And one of the major concerns that we highlighted that's often a challenge when other states have changed things like the income eligibility, or even challenges that we've actually seen in our own state as there's been additional requirements imposed in order to keep to remain eligible for these programs. One of those common things is the challenge of actually successfully transitioning from one type of coverage to another type of coverage. And so that's why we encourage folks to be very proactive in actually reaching out to Enroll the Ridge, to find another program and enroll in it, and to understand the differences in those new programs. So things like, is there a deductible? What are the associated co-pays? What am I going to have to pay for my prescription drugs in the future? So talking through those changes with the navigator, but also being proactive and reaching out to Legal Aid of Arkansas if you think you are going to be impacted by some of these changes, potentially no longer be eligible, or you're unsure about how to comply with the new guidelines. And so that's just really important, because these types of transitions can just be a barrier just because of a new policy that you have to understand, that you have to comply with, and that you have a limited amount of time to actually demonstrate compliance. And as Kevin said, you get sort of three strikes, you're out as it relates to that work requirement. And so if you are not complying, say you just don't realize you need to, and you get to March next year, you will not be able to re-enroll or eligible for the program for the remainder of that calendar year. So again, we really encourage people to be proactive. You certainly can contact, I think, either of us too, if you don't want to post a question and you want to ask some follow-up things in private. I think we're both very happy for you to contact us. You are welcome to go through Medicaid Saves Lives, send a private message through email. I'm sort of volunteering Lainey here but I don't think she minds if you want to be connected to any of us individually to talk more about some of the things we've said today.
And just as kind of a last word from my perspective, I always hate when people, this morning I was on the phone with my health insurance company and they couldn't tell me whether a provider was in network or not. They forced me to call 4 other people. So I hate making people go through that. So just so you're aware, what Enroll the Ridge does and Legal Aid of Arkansas do are different, okay? Absolutely. So we're giving you kind of 2 separate resources. Enroll the Ridge is really, if you're gonna be kicked off and you need to find new insurance on the Obamacare marketplace, that's what Enroll the Ridge can do for you, is they can actually help you sign up for insurance. Legal Aid of Arkansas can't do that. What Legal Aid of Arkansas can do for you is if you think you're gonna be affected by the changes, we can confirm that with you. We can go over your situation and let you know, yeah, you will be. If you want to know your legal rights or what legal recourse might be available if you're going to be affected, we can do that for you. So that's all stuff that we can do, okay? And I just wanted to make that kind of distinction so folks aren't left calling everybody in.
Right, and again, if you're unsure about who to reach out to or who to call, please do send a message through the Facebook page, and you can reach out to Lainey at Medicaid Saves Lives, and she'll get with us, and we can help try and navigate you to the appropriate place based on your particular scenario, definitely. And if you know how to contact me directly, I didn't make a nifty little thing to hold up with my email address, but you can always contact me too. I'm at Arkansas Advocates for Children and Families. I'm Marquita Little, health policy director. You can go to our website. We have more information there. You can call, you can send me an email, and we will do the best we can to help navigate you to the appropriate resource.
All right. Well, thank y'all for joining us. The great thing about this video is that you can play it back and rewatch it for any of this information. I really want to thank Marquita and Kevin for being here to educate us on all these things. They're very complicated things, but they've made them accessible to us and understandable. Arkansas Advocates for Children and Families and Legal Aid of Arkansas are two groups who are always behind the scenes advocating for us and trying to help us. And what they do is not always seen for everyone. And I just want to thank them so much for all their hard work. I mean, it's a lot of work to understand this and to explain it to us. So thank you both so much for being here today and for helping us do this. Also, we would really appreciate it if you would share this video and make sure that anybody who might happen to need this information would get it. So anyway, thank you all very much for joining us today, and hopefully we will talk to you all soon. Thanks.
Bye-bye.
Thank you, guys.
Thanks.